Ankle sprains are one of the most common musculoskeletal injuries. The injury occurs when one or more of the ligaments in the ankle are stretched or torn, causing pain, swelling, and difficulty walking. It is important if you suffer an ankle sprain to report it and seek medical attention, as without proper treatment and rehabilitation, your ankle will not heal well, resulting in recurrent sprains in the future. The most common type of ankle sprain is an inversion injury. This is where your foot rolls inwards, damaging the ligaments of the outer ankle, the anterior taliofibular ligament, the calcaneal fibular ligament, and the posterior taliofibular ligament. So, who is at risk of an ankle sprain? It is important when working on uneven terrain, near gutters, or getting on and off trucks to scope the area that you're working in, particularly if you work in roles that involve a lot of walking. For example, common hazards can include weather, gutters, wet grass, slippery driveways, uneven terrain, unidentified assets, and confined working conditions. Did you know you have an increased risk of an ankle sprain if you've had one before? And if you've had an ankle sprain in the last year, you are 2 times more likely to re-injure your ankle again. So if you don't follow a structured rehabilitation program to build up your ankle strength and balance, then you have a higher risk of re-injuring your ankle. So what do you do if you sprain your ankle? So research shows that we want to move from the RICE protocol to the police protocol when treating ankle sprains. P stands for protect, and this is where you use a support or a splint depending on how bad your ankle sprain is. OL stands for optimal loading. While it is important to rest our ankle, we also want to walk around to avoid joint stiffness, muscle weakness, and poor balance. I stands for ice, and this is where you want to apply ice to the ankle for 15 to 20 minutes to reduce swelling and pain. Make sure you apply a towel in between the ice and your skin to avoid an ice burn. C stands for compression. We want to compress the injury either with some tubie grip or a bandage in order to reduce swelling. Your doctor or physiotherapist can help you with this. E stands for elevate, and you want to elevate your ankle above hip height for as often as you can in the first 72 hours. So how do you prevent an ankle sprain? Well, you can prevent an ankle sprain by completing some exercises in the morning that would take 1 to 2 minutes of your time. We want to start first with some ankle pumps. Taking your ankle, moving forward and back, repeat this 10 times. The next one is what we call toe curls, and we want to do this 10 times. This is then followed by ankles side to sides. And the last one is ankle rolls. And then repeat in the other direction. So then this is followed by 10 calf raises. Followed by a 30-second calf stretch, making sure your heel at the back is on the floor and pushing your knee in towards the wall. Make sure you swap and repeat this on the other side. After a long day of work, it's important that you look after your ankle, and you can do this by following our evening foot pamper routine, which will take 2 to 5 minutes. Start by rolling out the back of your calf using an acupressure ball or a tennis ball. This will be then followed down to the bottom of your foot or the plantar fascia. Roll for up to 2 minutes. This is then followed by the calf stretch for 30 seconds on both sides. So you want to finish the evening routine by conducting a skin check, which will take 20 to 30 seconds, looking for blisters and cuts. You can then treat these blisters or cuts by soaking your feet in an antibacterial wash for a few minutes. Don't forget, to avoid an ankle sprain, you want to zip up your shoe and tie your shoelaces up correctly. If you have any concerns or questions, contact Health Services.